All right, so we're going to go ahead and do our lower back recipe. In this lower back recipe, we're going to be doing some cross-fibering, but we're also going to introduce a couple of techniques that you may or may not have already been exposed to. They're kind of like deep tissue techniques. The first one that we're going to do is a superficial fascial manipulation. And what we're going to do is we're going to cause the skin to stretch and slide over the deeper muscles. So the point of this technique is to make sure that we get a friction lock, a sticky lock on the skin. And we also don't want our pressure to go so deep that it actually goes down to the muscles. We want to keep our pressure a little bit on the superficial side so we can just stretch the skin out and not work the deeper tissues. So for this first one, I'm going to stand at the head of the table. I'm going to take a bow stance that looks directly down the table. When we do this the first time, we can take our palms basically over the shoulders. And a lot of times before I begin this technique, what I'll do is I'll just kind of check and see how stretchy their skin is in each of the four main directions. You can check the diagonals too if you want. And the nice thing about checking this before is that after you've done the first couple techniques, a lot of times if you check back again, you'll see that there's been a lot of change that's been created. So what we're going to do, again, is we'll place our hands onto the shoulders. We're going to push until the skin reaches the end of its stretch, and we're going to hold it here. And we're going to wait. Sometimes this change can happen in a few seconds, but other times it can take up to a couple minutes. And what we're going to do is we're going to wait for our sticky force, our friction force, to start to allow the skin to stretch and slide over the deeper muscles. So again, remember that the point of this technique is not to let your hands slide over the skin. You're trying to make their skin stretch and slide instead of letting your hand glide over the surface. Now this move can take a while. I'm going to kind of accelerate and get us down into the low back a little bit more. But you'll often feel as you execute this technique that you have like kind of a wave of soft tissue in front of your fingers or sometimes even under your palms. And that's generally a good thing. It tells us that we're picking up a lot of the skin and the fascial tissues and creating a wave of movement for them. Now once you've done this parallel to the spine up and down the back, it's good for you to try to experiment with different directions. We can actually do kind of superficial myofascial pushes or fascial manipulations that go across the body, even sometimes over the spine. And we can also do some diagonal movements as well. So feel free to kind of experiment with this one. Like I said, it doesn't have to go up and down the back, but that's often the easiest place to start. Once you've finished experimenting with this move, you'll be ready for the next one. The next one that we're going to be talking about is actually skin rolling. When we're doing skin rolling, basically what we're literally going to be doing is picking up a roll of the skin and walking one roll across the body. It creates kind of a suctioning similar to cupping does, and it allows a lot of change to happen between the superficial fascia and the skin. So we can create a lot of space and a lot of shifting in the top layers of the body. I'm going to be standing in the same place as I was for the fascial manipulation, a bow stance that faces down the table. And I would say the easiest place for us to start with skin rolling is basically over the trapezius and down the rhomboid. This alley between the spine and the shoulder blade is really quite ideal for learning how to do this technique. So I'm going to start all the way up at the trap, and what I'm going to do is I'm just going to go ahead and pinch and create a roll of tissue. And then my objective at this point is to keep this roll going. One of my two hands is always going to be kind of lightly pinching to roll, so that way it doesn't sink back onto the surface of the skin. And you can kind of see each hand takes its own turn. It walks forward to grab a little bit more tissue and keep the skin roll going. And we can take this technically in any direction, but oftentimes going up and down the back in this spot tends to be the easiest way for us to begin. Once we've done it up and down the back in this spot, we can try experimenting with different directions. Again, we can go laterally or diagonally. We can go down or up the body. For instance, we could just say, let's try this one for instance. We'll come from the spine. We'll get a roll of tissue and we'll just walk it lightly out towards the lateral shoulder. So again, this technique can be done anywhere. Now there's a second way to do a skin rolling technique, and it's kind of a gather and push type of technique. This technique works better in diagonals and laterally than it does up and down the body. And basically what we do is I would take a bow stance looking diagonally down the body. I'm going to come out to the lat and I'm going to gather the tissue up to the spine. My second hand is going to sit here, and you can see I've created a light roll. Now what's going to happen is my fingers are going to push forward, my stance pushes me forward, and as I continue, my second hand lightly lifts away to allow the roll to move through the lat down to the center of the body, or down to the side of the body. So whichever technique you decide to use, there are two techniques and they do have different uses. but this is basics of skin rolling. When you've done some experimentation with skin rolling throughout the back, you'll be ready to take the next move on. All right, so the next thing that we're going to do is a bit like a stretch. We're going to be doing a cross push. What we'll do is we'll stand on the same side of the table as the body that we're trying to address. We're going to stand into a horse stance, and we're going to hook our palms onto different spots. Now when we do this move, we're going to have our one palm hooked on the iliac crest and one palm kind of hooked on the back of the ribs. In order to create the push across, we're going to sink into our stance, and as we drop down, our body weight is going to naturally push our palms apart. Now when you do this, you don't want to bounce into this rapidly. Just like any stretch, you want to go slow, smooth, and easy. Make sure that you're communicating with your client if they haven't experienced this move before. So again, I'm going to take my right hand here, I'm going to hook it onto the iliac crest. I'm going to take my left palm, crossing over and kind of hooking onto the back of the ribs. I'm going to go ahead and sink deeper into my horse stance and allow my body weight to press my hands apart from each other. I'm going to hold the stretch for a moment, and then I'm going to stand back up and release the stretch. I'm going to move my palms slightly farther up the ribs. I'm going to drop back into my stance, pushing my hands apart, gradually letting out, and I can probably do up to maybe 3 of these contacts with my hand going up the ribs a little higher each time. By the time your hand reaches the scapula, this side stretch is no longer going to be effective. So if you only get 2 or 3 spots out of it, that's okay. Once you've done that, you'll be ready to take on the next move. Okay, so the next move we're doing is going to be a cross fiber for the erector spinae. Remember, the erector spinae run parallel with the spine up and down the body. There are 3 sets of them. The spinalis is the one that's tucked away just in the laminar groove, in the little groove next to the spinous processes of the vertebrae. The longissimus is the one that's really obvious. Usually when you go back and forth over the erectors, there's usually one big bump that you can feel, and that's typically the longissimus. And then the third set is the iliocostalis. These are usually not as evident as the longissimus, but you'll find them oftentimes a little bit more lateral on the ribs, and this is also the set of the erectors that tend to sometimes hide underneath the scapula. So we'll go ahead and step into a bow stance. Remember, our bow stance is looking directly across the table. A lot of times using a more fine tool like fingertips or short knuckles is a good tool to choose here. We're going to press into the tissue, sink down into the erectors, and then once we're there, we can start our cross fiber. Now there's a lot of space on the erectors, so there's a lot of spots for you to potentially choose. This is going to be one of those things where you don't usually cross fiber all of the erector spinae. You want to try to pick and choose the best spots, the ones that feel like they need the attention more than others. And as you practice, you'll probably get a better and better intuition on choosing those spots that are very valuable to your client. If you don't know where to go to start with, a lot of times the easiest thing to do is just cross fiber the longissimus, because that one's the easiest one to feel and to tell that you're actually doing the cross fiber on it. Once you've done a cross fiber from the mid back down into the low back, you'll have finished cross fibering the erectors, and we'll move on to the next step. So the next muscle that we're going to be addressing is Quadratus lumborum, or just QL. When we're working on this muscle, I just want to remind you that for some people this muscle doesn't get a lot of work, so they can be kind of sensitive in this area. In addition to that, when we work QL for somebody that maybe hasn't received or isn't familiar with the work, usually we want to do more of the work closer to the iliac crest. The 12th rib can be an area that can be more easily irritated and might feel more pain after the technique. So especially when you're practicing, it's probably better to cross fiber QL closer to the iliac crest than to the 12th rib. When we begin this technique, I'm going to use a bow stance that faces directly across the table. I'm going to start by kind of palpating the iliac crest to get a sense of where that lower edge is. And once I know where that line is, I'm going to go just above it. I'll go ahead and start by working more medially on the back. Now just remember that there's a lot of thick and tough muscle and fascia in this area, so when you sink in, remember to use a gentle but firm amount of pressure to sink down to the QL. And then once you're there, you can use your stance to lightly rock a cross fiber into the QL. It's more medial fibers. You can step very lightly out. It's not a very long or a very wide muscle, so if you take big steps, you're going to fall off of it very quickly. And when you get to the very edge, a lot of times instead of coming out all the way to the edge and trying to push down, sometimes what's even more effective is trying to take some of the some of the tissue from the back and lift it up and kind of hook your fingers underneath. And that kind of allows you almost to just go right around those tissues and really just cross fiber the very side of the QL directly. Okay, once you've hit those 3 locations, you can say that you've cross fibered QL and we're ready to move on. Okay, so the next spot that we're going to address is actually the SI or sacroiliac joint. In order to get this one, we're going to be working very close to where we were with the QL just a moment ago. The bony landmark that's really going to be important for us to find this time is going to be PSIS again, or posterior superior iliac spine. If you're not really familiar with how to find this bump, an easy way is often to just palpate the top of the iliac crest and to follow it medially, and it naturally becomes the iliac spine or the posterior iliac spine. So the first finger-like bump that you feel there is going to be PSIS. Once you've located that spot, basically what we're going to do is we're going to cross fiber medially and just superior of this spot, and we're going to cross fiber like we're trying to scoop under that bump. So I'm going to take my bow stance, and I'm going to be facing down and just across the table. I'm going to take this spot, this PSIS, and again I'm going to step my hand back a little bit superior and a little bit medial, and I'm going to start cross fibering kind of like I'm trying to scoop underneath that bump. And we don't have to just go towards that bump. We can go a little bit more out laterally this way, just a little bit, or we can turn our vector to be a little bit more up and down like we were just going almost towards the tailbone. People have varying degrees of sensitivity in this spot as well. There's some people that are very sensitive to pressure in this area, so just be mindful, work with your client as per usual. And when you're ready, we can go ahead and move on to the next set of moves. Okay, so the last move that we're going to do before we go into the circulatory piece of our low back is we're going to do a palm knead on the erectors. Now in order to do the palm knead, I'm just going to go ahead and set myself in a bow stance looking directly across the table like usual. In this case, we're going to address the erectors on the opposite side of the body first. So I'm going to place my palms just on the other side of the spine, and we're going to consider this more of a knead. So we're going to kind of roll between our palm and kind of pushing back on our metacarpals. So kind of like the base of our fingertips. We're going to kind of roll the erectors out and lightly roll them back in. Now this technique, you could technically do it on the erectors of the same side of the back as well. It will feel different to the client because on this side, when I work the opposite side, I'm kind of pressing and stretching the erectors away from the spine. For instance, if I were to do this on the same side of the body, it's basically the same kind of movement. But when I press into the erectors, I'm actually kind of gathering them up and compressing them onto the spine. Client often feels like both of them are feeling pretty good, but they are going to have slightly different impacts. They're going to feel a little bit different. All right, and once you've done the palm kneading for the erectors, we'll be ready to go into our circulatory moves. So we're going to go ahead and kick off. We're doing our circulatory routine for the low back. In truth, it's going to include some of the upper and mid back as well. First step that we're going to be going over today is actually for the erectors. We're going to use our 5 normal techniques, palm, knuckle, trench, thumb, and iron, to work over the erectors. First thing I'm going to do is go ahead and move to the top of the table using a bow stance. I'm looking down the table now. I'm just doing a little bit of an effleurage to go ahead and add my lotion onto the surface. And now I'm going to go ahead and start with my palm, pressing down all the way through the erectors. One thing I want to kind of bring to your attention is as I approach the low back, be careful not to put a lot of direct down force into the low back. This is kind of a vulnerable area. It's known as being a kind of an endangerment spot. So when you go over the low back, be careful not to overload with down pressure. You want to think about kind of pushing forward more than down as you cover this spot. We'll go into our knuckles next. Then into our trench. As per usual, try to find slightly different spots to stroke so it doesn't feel like you're just getting the same spot over and over. Remember, the circulatory massage is often an excellent tool to make everything feel like it's getting a touch. We'll go into our thumbs next. And then finally our iron. Now our iron can be used a couple ways. The basic stroke looks like this. We get our iron straight on until we pass the scapula, and then we're going to go ahead and turn the elbow wide to take it down the rest of the back. Again, this is the basic stroke. Now potentially we could add on a flourish to that elbow or that ironing stroke where we go down the scapula, we go wide once we clear the scapula, and when we get to the low back we can kind of turn it around and bring it all the way back up and kind of drop it through and over the shoulder. And if I wanted to, I could even come back and kind of make this kind of a swirling kind of a movement. Even if you don't choose to do the more elaborate iron, just the basic one will do. Once you've done this, we're ready to do the next muscle. Now that we've finished the erectors, we're ready for a real quick move. It's a very simple move for Quadratus lumborum. We're going to do this one across the table. All I'm going to do is set my bow stance, again my front foot pointed straight across, and we're going to use a trench on the QL. And that means that we're going to need to make sure that we know where the QL is. If you need to, palpate the iliac crest. Once you've found it, we're going to use a trench to push forward and down. We want to think about our vector as kind of carrying diagonally down and through. And you can almost like pull and scrape back to kind of add a second stroke on the way back as well. Just make sure that you're not trying to pull through your shoulders, that you're actually using your stance to push forward and to slide backwards, using the bow stance and your shifting weight to really push and pull this trench. And with that, nice simple move, we're ready for the next one. So the next thing that we're going to be working on is Latissimus dorsi again. When we do this move, we're going to be standing kind of at the client's hip in a bow stance that faces up towards the table. If their arm's at their side, we're going to take their arm and set it out to the side of the table this time. And our stroke is going to come from the low back, thinking about the latissimus, and pushing around the rib cage up into the back of the armpit or the back of the axilla. And we're going to do this stroke a few times with a palm and then a knuckle. So let's go ahead and do this. Now ultimately the stroke, you could potentially do it with either hand. I like using the outside hand because when I use my inside hand, when I get to the armpit, you kind of see how my arm takes this weird kind of turn. That's not really conducive to like good mechanics for the shoulder. So I like using the outside arm to kind of set myself back and allow that arm to come out. And you can see that as I get to the armpit, this arm is in a much more neutral, much easier posture. So we're just going to do this stroke a few times with our palm, starting from the low back, coming out around the rib cage and up towards the back of the axilla. Once we've done that palm a few times, we can switch it to a soft fist and bring a knuckle through here as well. And with that done, we're ready for the last move of our circulatory for the low back. All right, so the last move that we're going to do for our circulatory of the low back is going to address the QL one more time. Now the first time we did QL, we kind of did it from across, almost like a cross fiber. This time we're going to be going up and down the back. So I'm going to take my bow stance, I'm going to stand around the corner of the table, facing down towards the foot, and we're going to palm, knuckle, trench, and thumb over the QL. Now when we palpate and feel for the QL, it's below the 12th rib and above the iliac crest. This space is usually only like a couple, maybe 3 inches long or so, so these are going to be tiny little strokes. Remember that when you're doing low back work, you don't want to put a lot of pressure straight down. You want to make sure that your pressure is always sliding forward, like almost like you're aiming for their knee more than you're aiming for the table. So we'll start with our palm stroke, and you'll see here, really short, tiny little strokes. I'm almost using the heel of my palm a little bit more just because it's such a small space. And even as I'm doing this, I'm trying to just create a little bit of variety. So I'm not just doing the same spot over and over. I'm going a little bit lateral and a little bit medial. Once I've done my palm strokes, I'm going to bring my knuckles through here. Same idea, using my knuckling strokes, trying to get slight variety in specific spots that I'm pressing through, trying not to overload the low back with straight down pressure. Then we'll do our trench, pointed fingers, raised palm like usual. And lastly, we'll go with thumbs to finish this spot. Okay, so once we've done those 4 techniques into the QL here, we'll be ready to address the second side. Once you've done both sides, you finish the circulatory techniques for the low back. So we'll see you next time.